All right, good afternoon, everyone. As was said by Alan, I am Erin Seuss on loan from Cypress Health Region, and I had the pleasure this last month of being the team lead for the Child and Youth RPIW number 10, which was cycle time and waitlist reduction for youth services team. Today our team's going to be presenting to a Tac Time of 20 minutes, and this is our agenda for our presentation. This is a photograph of our awesome team who did some really excellent work this week, and I'm going to let them each introduce themselves as they come up to the mic today. This is a picture of our value stream map in youth services, and the scope of our project was looking from the time of registration with youth services to the time that a client would receive an evidence-based treatment plan. We also did a lot of data collection in the 3 weeks leading up to the RPIW event week. This is a snapshot of the wait list by department in Child and Youth Services, and as you can see, the youth team had a wait list of 40, and this was the major area or issue that we were trying to contribute to during this event week, was to reduce that wait list. This is another piece of PQA data, which was the number of incoming referrals to the agency, and on average, the agency is receiving 114 referrals per month for services. We then looked at referrals by program, and our youth team had referrals of 81 over a 3-month period, or 27 per month, and this was the area we decided to focus in on after seeking some guidance from our process owner. From there, we created our project form, and the project form basically outlines the scope and high-level process map, and it also helped us to populate our targets and boundaries or scope of the project. So we had 3 main focuses, and those were cycle time reduction, establishment of a treatment plan, as well as working towards eliminating no-shows and cancellations, and also to complete a miniature 5S. This is our target progress report and results sheet, and just some of the things we worked on this week were reducing space in a pamphlet cupboard. We looked at reducing the caseload per clinician, reducing our walking distance for printing, increasing clinician capacity to see clients, as well as capacity to see new clients, reducing our defects, and defects were no-shows and cancellations, and then reducing our overall setup or preparation time for appointments, as well as the overall cycle time. So that included our preparation, our treatment or assessment, as well as our charting time. We calculated our Tac Time, and that's the rate at which we have to work to meet demand, and our overall Tac Time ended up being that our youth team would have to process 1 client every 71 minutes in order to keep up with the current demand. We also did a Swot Analysis and identified many strengths and many opportunities for improvement within the agency. It was a good exercise to just look at the bigger picture of the Child and Youth Agency. We also completed in our weeks leading up and during some time observations, and this is an example of a time observation that we did on a typical clinician day. We also looked at standard work combination sheets as a way to assess, were we meeting our Tac Time. This particular one is for existing clients and their treatments, and we weren't quite meeting Tac Time with that. We did a second one also, pre-Kaizen, on new client appointments, and we realized that we were far over the Tac Time for new appointments, but there's very necessary things that must occur. We also did some spaghetti diagrams looking at clinician walking distance, and we found that there was a really long walking distance for a lot of our clinicians in the youth services team. And last but not least, we did a percent load bar chart looking at the different components of work. So for clinicians, for that cycle time, there was prep time, treatment or assessment time, and then the charting time. And we were wanting to see if there were ways to shrink the charting time as well as the prep time, and just really not do much around the treatment time. We were wanting to give the clients as much treatment time as possible. I'll now hand it to Janice for Kaizen 1. Thank you.
Hello, I'm Janice Giroux, and I'd like to talk about Kaizen number 1, which is the walking step time reduction. We had an idea summary sheet that before our improvement, we knew that our clinicians were definitely walking way too far to the printer. And so the measures were taken was to relocate our printers. We relocated 2 of them. So our results obviously was less walking time and happier, more productive clinicians. So if you look at our first spaghetti diagram, I mean, this is huge, if you can believe it. The round trip was 1,800 feet, round trip, which is 1 minute 46 seconds. That's a lot of time. And now, amazingly, 7.5 feet, which is 6 seconds. So this is great. Also, our second clinician, we looked at what they were doing. This is on the first floor of the facility. They had 183 feet round trip, which was 1 minute 30 seconds. Again, a long time. And now, there you go, 42 feet, which is 16 seconds round trip. Also, Kaizen number 2 is looking at no-shows and cancellations. And again, there was a review of 12% of defects were found with no shows, and that was an audit done in the month of November. And obviously, people are not getting services if that's how many people are not showing up. So there we go. An idea for an idea summary sheet was for new clients and existing clients need to get a call or a reminder. So we looked at some standard work. So the administration is making some calls to the new patients to remind them of their appointments. And the clinicians are following up with the follow-up appointments. And again, the results of this is reduced no-shows. And we've already started this on Wednesday. Again, what happened pre-Kaizen, a letter would be sent out to clients to say this is your appointment. It was done by the admin staff. And now we have a post-Kaizen letter that's much improved. Basically, it says contact intake if you can't make this appointment and do it within 72 hours. So then we're just giving them a little bit of an encouragement to make sure that they call. Again, looking at our standard work, so if you look at the intake, appointment, confirmation, and rebooking, now our administration staff know that 48 hours prior to a new intake appointment, they're going to call and confirm that appointment time. Again, this was also sent with clients for their appointment, but now this was pre-Kaizen, and now post-Kaizen, what happens is with the treatment contact note, the clinician and the client have an opportunity to look at, is this new appointment going to work for them? And then they can take this home with them. Also, it also talks about the tasks and who will be doing their tasks for their plan and follow-up of care. Again, you want to move that down a bit, Barry? Thanks. This is, again, looking at standard work that we prepared, the treatment, appointment, confirmation, and rebooking. This is going to be done by clinician staff. So again, they'll put this in their schedule. So 48 hours prior to their appointment, they will call each client to confirm, and then there's the process for them to do that. Again, for no-show, we have some standard work, what to do for the clinician. So this is very important. If the client hasn't arrived within 15 minutes, the client will attempt to contact that client to find out and identify what those barriers are.
Hi, my name is Marlene Brenzel. I'm here to report on Kaizen number 3, schedule booking standardization. Prior to the Kaizen, or the RPIW, there was a review of how appointments were scheduled throughout the day and week. And the first thought was to actually level the load. However, it was deemed not client responsive because a lot of clients wish to have late in the day appointments. There was also no standardization in how a client might be booked in the day or how many would be seen. And lastly, clinicians were unaware of how many appointments needed to be booked in order to meet client demand. So post-Kaizen, with the assistance of clinical staff, we have established work blocks and suggestions of what might go into those work blocks. So now the clinician has a clear picture of how many appointments are needed to meet the need, and there's also flexibility within their week in order to do that. And we've also implemented some established report writing time in order to assist the clinicians in providing diagnostic information to clients as soon as possible. Okay. Next is Kaizen number 4, charting time reduction. Contact notes are a fun thing for clinicians. Prior to the RPIW, the contact notes were unstandardized. They were difficult for covering clinicians to decipher, and clinicians would often complete them at a later date, increasing that pressure to get them complete. Therefore, now we have provided a new contact note with concise categories to ease the completion of the form. The process engages the client in setting goals and scheduling appointments. And with IT Magic, the tasks and next appointment phase is automatically put onto the next page that can be printed off and given to the client. And the note is completed in the session, reducing batching. And there's also standard work for how these can be completed in office appointments and out of office.
Hi, I'm Cheryl Demke. I'm going to be reporting on Kaizen number 5, which is caseload, clear definition, and reduction. So pre-Kaizen, we looked at the average number of cases for clinicians, which was 74. We also looked at the process for closing files. Clinicians used a goal termination form, the one that was ripped up on the screen there, and change of status form. Both forms took time to complete, and it was a long process to close the file. So the summary sheet, this identified high caseloads as problematic and stressful for clinicians. The measure that was taken was to review the caseload every 3 minutes to inactivate the file. So post-Kaizen, we revised the change of status form, and now the clinician has to just fill in the client name and file number and check off the inactivation box. The goal termination form has been replaced by the new revised contact note. And we also looked at standard work, which was created around inactivating the files. So the results of the audit show that the new process will reduce caseloads from 74 to 33, which will then create less stress for clinicians. Thanks.
Good afternoon. I'm Mona Flood, and I'm here to talk about Kaizen number 6, which is the treatment plan development. So prior to the development of the treatment plan for the youth team, there really wasn't any treatment plan. And so what people had to do was you had to sift through the file and look through the clinician's contact notes to try to figure out what the goals of treatment were. And it really wasn't clear when treatment was starting or when treatment was ending or how progress was being evaluated. So what we did was we created a treatment plan form. And we trialed this with the staff, and we tweaked it. And now we have a form that will stay on the file. Clinicians will sit down with the clients, and they will identify the goals that they're working on with treatment. They will identify the plan of how many sessions it will take to get the treatment finished, and they will be able to progress and track the treatment at each session. And we've also created standard work documents for the youth team psychologists and social workers so that they're clear on exactly how to fill out this treatment plan form. The next Kaizen is Kaizen number 7, which is information resources. So this is our storage cabinet where we keep all of our pamphlets and resources. And at this time, before we started this project, it's very messy. It's very cluttered, it's very outdated, it's not easy for clinicians to access or use. Nobody wanted to go anywhere near that cabinet. So what we did is we took everything out of the cabinet, we laid it on the table in the staff room, we asked staff to put sticky notes on what pamphlets they wanted kept, and if there were no sticky notes, then we garbaged those. When we initially looked at our storage cabinet, we had a score of 1.1. which was not a very good score for a beginning. This is a picture showing all of the pamphlets that we garbaged, and some of them were quite outdated, like 20 years old, so we got rid of a lot of things. And now this is our final picture of a very well-organized cabinet that has current resources. There's pictures on the front with the labels so that clinicians can easily find resources. And at our final rating, we had a much improved rating of 2.6 on our storage cabinet. Thank you.
Hi, I'm Larry Olson. I'm the sub-team lead for this RPIW. I'm also from Cyprus on loan, or the player to be named later. So I'm here to talk about Kaizen number 8, which is the clinical visual improvement. When you used to walk down, and actually you can see it here on the video, but when you used to walk down the hallway, they had a sign that said, this way to Moose Jaw. So if you turned left, you ended up in Gravelberg and not at reception. So we changed the signs to reflect what they actually were, boardroom, reception, so that people actually knew where they were going, because this building's kind of a maze to begin with. So here's some of our post-Kaizen data. We did our time observation on a existing client. The time for a treatment took 63.2 minutes. Here's our standard combination worksheet. This really didn't change for new intake because there's a lot of data gathering, and we're above our Tac Time here, which we're well aware of. The existing client, as you can see, we're now below Tac Time, just a hair, but we did get it below Tac Time, which you can see here too on our percent load charts. Okay, we did some multiple skill training checklists to be handed off to our process owners who are just itching to get these. So we have stuff for our clinicians, our intake workers, and our admin staff. And our newspaper starts off with a good Sudoku puzzle, followed by a nice little cartoon that Sensei actually interpreted as get off your ass and get to the Gemba. Some of the newspaper items that we still have to deal with, the printers haven't been moved yet. They're supposed to be moved on Monday. We have the clinician, one of the clinicians hasn't gone through and inactivated her files yet, and the new status change form hasn't gone to the print shop yet. So here's our target progress report. We had some significant increases or decreases, as you can see. Our walking distance, as you seen earlier, was down 99%. Our inventory on the caseload per clinician, which was something that our clinicians had hanging over their head, that they had these big caseloads. After we went through and inactivated them, kind of lightens the load a bit. That was a 55% decrease. Of course, the space in the resource cabinet was dropped by 20%. Our defects, because, well, we really only had 2 days to monitor our Kaizen in this, but it's down 80%. Only one person didn't show up. So that was a huge gain there. And our productivity gain, we doubled from 1.7 to 3.4, and it's still below our Tac Time, but still it's a big increase. The 5S scores obviously went up 37%. And one of the other big things was our capacity. We went from 1.4 to 2%, which was a 30% gain.
Hello, I'm the consumer representative. So some of the Kaizen improvements have been clinician walking time to printers reduced by 99.2%, standardized contact note, which improves communication and charting done at time of contact, standard booking schedule helps to meet client demand, caseload per clinician decreased by 55%, standard work reduced and for no-shows and cancellations, reduces that. Treatment plan provides clear goals and timelines for clients and clinicians. So here are some staff testimonials after the improvements. One anonymous social worker said, "It brings the client directly into the treatment and planning." Crystal said, "It's awesome. It was overwhelming before." And Christy says, "I like the idea of giving a treatment contact note to clients. It encourages accountability and should reduce no-shows." And our team would now like to thank Sensei Shuno for his wisdom, guidance, patience, and sense of humor, Terry for interpreting and sharing her lean experiences with us, and the awesome staff at Child and Youth for the warm welcome, information, and sharing, opening their work site, and having the willingness to test these changes. The RPIW team for their hard work and patience, Glenna and Sarah for their support and leadership, and the RQHR leadership for this opportunity and experience.